let's go ahead and get into the types of neuropathy. Now, neuropathy is just a word that means nerve damage, right? Neuropathy, nerve damage. So this really covers a large spectrum of different conditions. Starting with the big categories, you have central neuropathy, and central neuropathy refers to brain and spinal cord damage. We're looking at things like stroke, brain trauma, multiple sclerosis, neurodegenerative diseases even. Those can create focal or widespread pain anywhere in the body, in addition to the other neurological symptoms that those patients can have. That's central neuropathy, brain and spinal cord problems. Peripheral neuropathy is the one that most people think of when they hear the word neuropathy, and that refers to damage to the nerves outside of the brain and the spine, right? It occurs, the symptoms occur out in the extremities. And we're going to get more into the different types of peripheral neuropathy. We're really going to focus mainly on peripheral neuropathy today. So a quick review on what the nerves in the periphery look like. So you've got your nucleus, cell body. You've got the axon, the long communicating strand from the cell body that is surrounded by a myelin sheath. And that goes all the way down to the terminal. So this is, you'd see a cell like this in the DRG, near the spine, and then these terminals go out to the very ends of the nerves, at the very ends of the extremities. You'll find these axon terminals in the toes, in the fingers, and then of course in the skin along there as well. But they don't just travel in single nerves, right? You have bundles, you have nerve bundles. So you're looking at more of a fiber, and a peripheral nerve fiber like this one in this diagram. So you've got these fascicles of nerves that go out, and these get smaller and smaller as you go further down the extremity, right? So you start off with a larger nerve, think of like the sciatic nerve, and then it gets smaller and smaller as you get further down the extremity. If you look really close, you'll also see the blood vessels that supply this peripheral nerve right here. And those are very, very small. They are very tiny. They are absolutely essential to nerve health, because without good blood flow, those nerves have a very, very hard time supplying those long axons. And so if you lose blood supply along a peripheral nerve, then it starts to have dysfunction. The smaller these nerves get, the smaller their blood vessels get as well, and the less blood supply they have. So again, neuropathy is nerve damage. And when we're talking peripheral neuropathies, we have mononeuropathies and we have polyneuropathies. So we'll need to distinguish those. We're going to talk first about mononeuropathies. And this is where you want to envision something like carpal tunnel syndrome, right? You have a nerve entrapment in the wrist, and that gives you symptoms out into these three, maybe four fingers, and then the palm and the thumb here, right? That's a mononeuropathy. One single nerve is affected, and it can be a compressive disorder. It can be trauma. It can be an inflammatory process. You can see this, like I said, with carpal tunnel syndrome, but even things like trigeminal neuralgia in the face. That's a peripheral mononeuropathy, right? So mono meaning one nerve is affected. When we're talking about polyneuropathy, that's when we're talking about damage to many nerves. So poly, many nerves, right? So we're looking at typically altered blood flow due to one of many, many different potential causes, which we'll get into here soon. But that altered blood flow ends up starving those very delicate nerve endings and that myelin sheath insulation, which can lead to exposed nerve endings or exposed nerve axons. And a good analogy for this is when you put your arm up on the back of the chair, have it up for there for a while, maybe you got a little bit of pressure kind of on the underside of the arm, you're putting some pressure on the nerve itself. What happens? Your hand falls asleep, right? You've starved the nerve of some of its blood flow. How do you fix that? You just get blood flow back into the hand, you shake it out, right? That's the example I typically will use with patients. And then I'll say, what if we had that arm up on the back of the chair for 5 years? Then what happens? Well, they can interpret from there. You have ongoing nerve problems, and restoring blood flow can be really a challenge. So again, peripheral mononeuropathies are going to be single nerves and something like carpal tunnel syndrome or Bell's palsy. Polyneuropathies are going to cover many different nerve endings. And because we're talking about altered blood flow, that's where we're going to then see more of an effect out in the extremities. So the tips of the fingers, tips of the toes, the bottom and the top of the foot, those are oftentimes the first ones affected because they already have the poorest blood flow. So many times it will start here in the fingertips, and then it'll work its way down the hand or down the foot, and then it can even start going up into the arm and the leg. So once those exposed fibers, you've got the damaged myelin sheath, you've got damaged nerve axons, even those can start sending unregulated signals to the brain. Brain will interpret that as pain. And another way that this can happen is when this altered blood flow starves the axons themselves, kind of bypasses the myelin sheath. And then what happens, instead of that extra signaling, the nerves just stop sending signals. So that's when you have numbness as a part of this. So a couple different ways that these polyneuropathies can damage the nerves. And you can have even direct damage by toxins within the body as well. And I'm not talking about, weird things in the air. We're talking about like medications, which again, we're going to get into the causes here in just a couple minutes. Okay, so we've got central neuropathy. You got peripheral neuropathy. Central neuropathy is going to be occurring in the brain and the spine. Your peripheral neuropathy is going to occur out in the extremities. And then when we break down peripheral neuropathy, we have our mono and our polyneuropathies. How do you tell those apart? Because that's really where we need to start with, right? When you have a patient in front of you and you're working to distinguish what type of neuropathy they're dealing with, start with central versus peripheral. Once you've got your central versus peripheral, then you need to know, are we talking mono or a polyneuropathy? Because this distinguishing process is what's going to give you the best chance of having an accurate diagnosis for the patient. And accurate diagnosis is absolutely essential to treatment. Okay, so generally, again, not with every case, but generally, if the symptoms are in both extremities, say both feet or both hands, or even the hands and the feet with this kind of classic stocking and glove distribution, then you're looking at a polyneuropathy. Generally, you can't just go off of that, but most of the time, if you have that distribution, it's going to be a polyneuropathy rather than a mononeuropathy, right? More than one nerve is affected. Think about your mononeuropathies more as a structural entrapment problem, typically, whereas your polyneuropathies are a whole body chemical issue. For example, probably the most prevalent polyneuropathy is diabetic neuropathy. We don't have a nerve entrapment in that case. In that case, we have nerve damage to multiple nerve sets. Whereas with, again, our carpal tunnel syndrome example, you've got a compressive disorder happening within the carpal tunnel itself that's pushing on that median nerve. So and again, this is pretty general. There are exceptions to this, but if you're looking at, 95% of the cases that are going to come in that are going to have nervous system complaints, then you're looking at this kind of a process for your diagnosis for distinguishing these different cases.